跟住啦，去到第15條咧，又去翻一啲陳述句嘅題目咯。呢兩句陳述句咧都係有關於我哋嘅循環系統微血管嘅。咁啊，血液喺微血管網當中流動得好慢啦。第二啦，就係微血管嘅管腔好窄啦。咁啊，成條題目啦，第一個要考核嘅概念就係有關於微血管嘅適應性特徵。微血管管腔直徑好細，僅大於一個紅血球嘅直徑，所以啲紅血球咧係要逐個咁樣行嘅。同埋啦，微血管壁咧只係由一層細胞所組成啦，佢係具有差異透性。咁今次嘅題目就冇問咁多差異透性嘅嘢嘅，純粹就係講下微血管喂好窄嘅喎，同埋啦微血管入面流嘅血液咧個速率咧係好慢喎，血流速率好慢喎。咁所以啦，我哋就要去諗下沿住血管而行嘅話，血流速率嘅改變啦，由大動脈去到大靜脈。咁當然啦，今次嘅主角係微血管啊嘛。一直咁樣行嘅話啦，咁個血流速率有咩嘅改變呢？咁啊睇翻 A、B、C、D 嘅 D 呢一幅圖咯。初頭喺動脈嘅時候咧，哇就好高嘅速率嘅，跟住慢慢跌，去到個微血管就係最低㗎啦。之後咧去翻個靜脈啊、大靜脈啊，又會快翻一啲。咁即係話本身睇呢一句説話咧，睇翻個微血管咧，佢係最慢嘅喎。咁所以啦，第一句係正確嘅。而頭先第二句啦，微血管直徑好細，咁即係佢好窄啦，咁都係正確嘅。但係問題啦，呢兩句有冇因果關係呢？第二句話微血管好窄，係咪就攞嚟解釋得到微血管嘅血流速率好低呢？咁我哋比較下 A 同埋 D 呢兩幅圖啦。咁 A 呢幅圖咧就係血管嘅直徑，咁初頭咧又係粗一啲嘅，跟住啦就係跌，去到嗰個微血管又真係好窄喎，咁啱啊，係咪？跟住啦就上翻去，咁又闊翻喎。喂，兩幅圖咧都叫做似地樣喎，係咪啊？咁係咪就代表住可以解釋得到咧？不是，你真正要釐清有關於血流速率嘅概念咧，係將血流速率同埋血管嘅總環切面面積拉上關係，即係睇下 B 呢一幅圖啦。咁由個大動脈開始啦，個總環切面面積咧都仲係低嘅。咁去到小動脈啦就開始增加，去到微血管咧就係最高，跟住啦再匯聚翻變咗做小靜脈啊，到靜脈再變大靜脈咧又低翻。其實真正嘅原因係佢先真。喺一個閉合嘅循環系統當中，佢嘅血流速率係同佢嘅總環切面面積係有關係。咁所以好快咁講翻一句啦，就係血流嘅速率咧，同埋呢個血管嘅總環切面嘅面積咧，佢哋係成一個反比嘅關係。咁即係話啦，個 velocity 咧就係等於1除翻呢個總環切面嘅面積。咁所以啦，環切面面積大咧，咁嗰個速率咧就好慢啦。反翻轉啦，總環切面面積細咧，咁個速率咧就會快啦。咁所以答案就係第二句係唔能夠解釋到第一句嘅。咁所以答案咧就係 B 啦。咁亦都想借呢個機會咧，同大家去釐清多一個概念啦，就係血流速率同血壓亦都係冇一個直接關係嘅。當初血壓喺大動脈咁梗係好高啦，跟住啦沿住血管而行，由於血管有阻力嘅，所以血壓就越嚟越低。咁所以啦，有好多同學咧都會誤會咗嘅。哎呀，初頭咧血壓好高啊，所以血流速率都好高咯，係咪啊？咁你又解釋唔到後面噶咯喎，血壓只會越嚟越低，咁點解血流速率又會高翻呢？係嘛？咁所以啦，血壓同埋呢個血流速率咧冇一個直接嘅邏輯因果關係嘅。咁呢個題目啦，有啲咩嘅題型變奏咧？咁下次可能啦就要你去解釋一下，究竟血液喺個身體組織當中嘅微血管流得咁慢啊，呢一件事啊有咩嘅重要性咧？咁你試下喺留言區留低你嘅答案，睇下你嘅概念清唔清？ Question 15 is about the statement analysis question. So there are two statements about the transport system. Blood flow slowly in the capillary bed, and the lumen of the capillary is narrow. So for the concept checking, surely we need to check the concept about the adaptive features of capillary. So for the lumen of capillary is only slightly larger than the diameter of a red blood cell. So it means that for the capillary is very, very narrow. And the wall of the capillaries are one cell thick and differentially permeable. But the question doesn't ask you that much about the differential permeability of the capillary. But we find that the lumen of the capillary is really narrow. So let's take a look at the blood flow rate, the velocity of the blood flow in the graph D. So you can see that starting from the aorta or the artery, so the blood velocity is high and then lower, 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 and then go to the capillary is really the lowest. And then after that, going to Leung, and then go back to the vena cava, the blood flow rate, the velocity of the blood flow become higher again. So for the statement 1, the blood flow slowly in the capillary bed is also correct. So both of the statements, they are correct. However, are there any cause and effect relationship, the causal relationship? So we need to realize the change of the blood flow rate or the velocity along the blood vessel, starting from the aorta, going to the capillary and go to the vena cava. How is the change? I have already shown you. And there are lots of graphs to take a look. So let's take a look at graph A, vessel diameter. So these two curves, the pattern is very similar. So for the diameter of the aorta are very large and then become lower, lower, lower. And for the capillary, it's very narrow. And then go back to the vena cava, it goes up again. So the vessel lumen become bigger. So for the graph, it seems like that the narrow diameter is related to the velocity of the blood flow. However, the concept you have to clarify is about the relationship between the blood flow rate or the velocity and the total cross-sectional area of the blood vessel. Therefore, we need to take a look at graph B, total cross-sectional area of the vessel, starting from the aorta artery, so it's very low, and starting from the arterial, going up, going up, going up, and then go to the capillary is the highest. And then after that, going to the vein and go back to vena cava. So the total cross-sectional area of the blood vessel, it drops, it becomes lower again. That's the correct reason to put these two concepts together. So what is the relationship between the velocity of the blood flow and the total cross-sectional area of the vessel? So actually the relationship is an inversive proportional. It means that for the velocity of the blood flow is equal to 1 over total cross-sectional area of the blood vessel. So what if the total cross-sectional area is higher, so the blood velocity will be lower? So what if the total cross-sectional area is lower, so the blood velocity will be higher? Therefore, statement number 2 does not explain statement number 1, so the answer is B. And I would like to grab this chance to talk about the average blood pressure. Some students, they also misunderstood that, the pressure is related to the velocity of the blood flow. No. Because once you say that the blood pressure in the aorta, in the artery, in the arterial high, and then become lower, lower, and lower because the blood travel along the blood vessel, and inside the blood vessel, there is the resistance. So to make the blood pressure become lower, lower, and lower. So you may think that, at the very beginning, when the blood pressure is high, so the blood velocity also high. So how can you explain the velocity of blood flow in vein and in vena cava? The pressure so low, but the velocity is going up. It doesn't make sense, right? Therefore, there is no logical relationship between the blood pressure and the velocity of blood flow. So next time, any possible question variation? So this time, I asked you about the slow blood flow in the capillary. So next time, I want you to explain the importance of the slow blood flow in the capillary in body tissue with appropriate example. For example, in the air sac, for example, in the villi. So try to share your answer in the comment section to check that if your concept is clear or not.